Hi everyone, this is Sarah Michalak. I'm a physician assistant here at Trillium Dermatology. Today I'm going to be talking to you about psoriasis, which is a condition that a lot of people have probably heard of, but there are some avenues of that disease that a lot of people aren't familiar with. So I'm hoping to just kind of educate you a little bit today with regards to what that disease all encompasses. So with that being said, psoriasis is very commonly a condition that affects the skin. It is actually an autoimmune condition. So generally what that means is you were born with the gene for psoriasis. Most of the time though, it takes some type of triggering event for you to experience your first outbreak with psoriasis. So patients tend to kind of come in with either a stressful life event, an illness, that generally will present with their first rash of the psoriasis. This isn't always the case, but generally this kind of onsets around age 20, and then we do see it later in life with time, so it doesn't have to be that early. What a lot of people don't realize is psoriasis not only affects the skin, but it does actually put you at increased risk for other comorbidities or other diseases. So for example, psoriasis does put you at a little increased risk for some mood changes or mood instability. So we always recommend a screening for depression, which generally can be done by your primary care doctor. The other thing that a lot of patients don't realize is you are at a slight increased risk for cardiovascular disease. This generally, we just recommend seeing your primary care physician once a year for your yearly screening, basically to make sure that there are no cardiovascular diseases developing, such as high blood pressure, high cholesterol, that sort of thing. Psoriasis also puts patient at an increased risk for weight gain, so that's another thing we generally recommend kind of monitoring through the process of psoriasis. So there is a component of psoriasis that we as dermatologists tend to get pretty concerned about, and that is actually the joint aspect of psoriasis. So 1 out of 3 patients with psoriasis will go on to develop what we call psoriatic arthritis. So this is typically characterized by joint aches and joint pains, which actually resemble stiffness in the morning. So this is after periods of immobility. So generally when patients wake up, they kind of have those stiff, achy joints until they get going with their day. The reason that we get so worked up and concerned about this component of psoriasis is because damage that is being done to the joints is actually irreversible. So you can have very mild skin disease, meaning you just have 1 or 2 little areas on that rash, and then, with time, the joint aches can be very severe. If you think that you're experiencing either psoriasis or psoriatic arthritis, we would definitely recommend an evaluation by your dermatologist to, 1, confirm the diagnosis and make sure that's what's going on, but we also want to focus on, help clearing your skin and then focus specifically on those joints as well. If you're interested in scheduling, we have online scheduling available, or you can call our office to schedule an appointment. Thank you.